Hello, listeners. Yamina here. Welcome to the Dr. GPCR podcast. Before we dive into this episode, we would like to take a moment and thank our Dr. GPCR Ecosystem partners for their support. Domain Therapeutics, GPCR Therapeutics, Design Pharmaceuticals, Montana Molecular, and Orion Biotechnology. We hope that you were able to join us at the Dr. GPCR Symposium on Molecular and Structural Insights in GPCR Activation. If not, you can go back and watch the recorded talks with your premium membership. Also, mark your calendar for the upcoming symposia on September 22nd on the topics of GPCRs as therapeutic targets. If you'd like to be considered as a speaker or have a speaker suggestion, please email us at hello@drgpcr.com. More information can be found in the ecosystem. If you haven't noticed yet, we've added menu buttons at the top of the page for your convenience to help you navigate the ecosystem more effectively. And now, let's dive into this episode. Hello, everyone. This is Yamina from Dr. GPCR, and today I'm delighted to have with me soon-to-be PhD, soon-to-be Dr. Jackie Lu from Australia. Hi, Jackie.
Hello, Amina. Nice to meet you again.
Nice to see you as well. And I hope I'm not wrong. I know you're finishing up your PhD, but have you defended your thesis yet?
No, not yet. Just closing to,
Okay, so soon to be Dr. Lu.
Yes.
I'm so excited to have you with us. Thank you so much again for coming today.
Thank you for having me.
So let's start with a quick introduction. If you can tell us who you are and what do you do?
Yeah, so now I'm in my final year as a PhD student in the Monash University in Australia, and I do study in GPCR. So specifically to characterize GPCRs in structural biology and pharmacology assays. Yeah.
That's great. And where were you before starting your PhD at Monash?
So I was still in Monash. So I did I worked as a research assistant in Monash University for 7 years. And so that's why I stayed quite a long time in there. Yeah.
We're in the same lab?
Yes. I worked with the same same PIs and yeah.
And what made you go into a PhD program after 7 years working in the lab?
Yeah, it's just like because prior to that I did my honors degree, and like some people chose to continue to do PhD straight after the honors degree, and at that time I don't feel I was ready, and like mentally or skill set I was not prepared, so I decided to try to do the RA work. And then I think after 7 years training, I feel like, okay, maybe I'm mentally and the skill set ready to take on more challenges, and more responsibility.
That's awesome. It's hard when you have quote unquote a job and then you say, no, I'm going to go back to school. But in your case, you spend the same time in the same lab. So how did it change? Like your daily activities, how did they change from working to being a PhD student?
I think it changed because my the view of this job changed. It's from like a routine, get job done and go home, and you may not need to think a lot about your work after you go home as a research assistant. And but after I changed to do PhD, even still in the same lab and doing like you overlap with essays you have done before, but the how to picturing this is different. And now I probably work in a more flexible time way, like suits me, but I know that I more intellectually involved in this project. And so in that sense, the routine has changed.
So now you go home and you're still thinking about your GPCR and your project because the stakes are different.
Yes, sometimes, yes.
Yes, I think it's still good to leave the project and its issues in the lab sometimes because it can be haunting. I remember doing experiments, and whenever I was, a lot of tubes or radioligand binding, and I went home and that night I dreamt that I was doing the experiment all over again with the tubes and the racks and all of that.
Yeah. It's good to have like a stop.
Yes. I think it's important. How did you get into studying GPCRs at all, even working in Chris Langmein's lab?
Yeah, so before working as a research assistant, I only know GPCR from textbook. But when I applied and got the job as an RA, I stepped into this department, which is drug discovery biology department in NIPS. And it seems like a GPCR to me that time, like everything is about GPCR. So I was really curious why this research, like this family, are so important and very interesting to be studied in here. And then I got like my interest to know
GPCRs. Yeah.
Yeah.
And did you always know you wanted to be a scientist?
It wasn't very clear along the way, but I think I was more clear about that. I'm always interested in biological science, that to know more about this, but specifically to be a scientist was more like towards the later on I realized that, okay, or maybe this is the goal or the
The reason I was asking you because we've had many guests, and sometimes they say, "Oh, I wanted to be in something else that has nothing to do with science," or they say, "Oh, I actually started out in chemistry or in physics, or I was good at math, and then I ended up working on GPCRs, or I was working at a bank, or in studying finance and reading Nature, and I switched."
Okay.
That's why I was wondering, like in your case as a child, did you have a favorite subject that was close to science and that kind of got you into the scientific world?
So as a child, I think I am not clear about what I am, what I was really really passionate for, but I did well in science subjects. So that's sort of like an indication, not indication, but I got interest in it, like in science subjects. But then I asked, when I have to go on to do the undergraduate, I have to sort of pick a subject that I want to do. And then it becomes like the biology stuff really becoming very interest to me.
Yeah, well, it's interesting because I was just talking to someone, and people have heard the story. So the reason why I ended up doing a bachelor's in biochemistry instead of chemistry is because on the sheet when you apply to the university, you had three choices, and biochemistry came before chemistry because it started with a B and not a G. And that's how I ended up in biochemistry. And a year in, we had a class about GPCRs with Michel Bouvier and Alisa Lapour. And that's when I was like, this is really, really cool. And I kind of got hooked into it. But he was not a very directed choice. He was kind of serendipity there. Me ending up and I'm glad that biochemistry started with a B and I got accepted, because I would have been a terrible chemist. A terrible chemist.
So when I started to choose, I know that I'm not that interested in like commerce, like a finance or those things, that I have like a definitely no in my mind. But then I am open to all those things that I don't have a no.
I think that's a great way to think about it. It's as important to know what you don't want to do, because then you don't even spend the time trying to think about, do you like it or not? It's a no. It's a categorical no.
Yeah.
Once you started as a PhD student, how did you, first of all, who inspired you to start your PhD program? Did Chris, for example, or someone in your entourage said, you're really talented, you've been working here as a research assistant, why don't you do a PhD? Or how did that even happen?
Yeah. So I think I'm still like a people-oriented person.
Yeah,
Like I need to know that I can get along with people, first of all.
of course.
So after working 7 years in the lab, I know that all the people, like the postdocs and the PIs in that lab are really, really great, inspiring, and I like their working styles as well. And the students in there are very, very friendly and lovely. So that I make sure, and then I chose to continue to do PhD in that lab, and because their working style are very I like how they do science, and that's why it inspired. Oh, maybe I can do a PhD, and I can look into the study like the receptors
Yeah.
um, as well. Yeah.
I think you make a great point when picking a lab or picking a place to work. And in your case, I mean, you spent 7 years in the same lab before starting a PhD, which means that starting a PhD was a no-brainer when it came to people and to the lab, to the environment that you were in. But anyone listening who's at the verge of picking their PhD program or lab and postdoc, it's very important to feel comfortable and to get to know people and ask questions. Sometimes you don't have the luxury of spending time in the lab like you did before starting there. But I think there's always a way to ask previous members to tell you how was their experience. And if you can do a rotation, I think it's great. It is really
Yes.
great.
Yes. Excuse me. So yeah, so now this the department is doing the rotation program, so you get chance to work with different peoples for six
Yeah.
like a three, you chose three labs in the first year, and you work with them for each of them for 6 weeks, and then you can get along with the supervisors, with the
Yeah.
lab people, and if you like the project.
Yeah, six. I think rotation programs are really great. I didn't have that luxury. And I think at that time, I don't think it exists in Canada as of
Okay.
yet.
Yeah.
But it's really good. 6 weeks is short, but it gives you a great idea. It's better than a 1 day interview day for sure.
Yeah, yeah. Yeah. So yeah, you get to know a bit more. Yeah.
Yeah, yeah. No, definitely. I think it's fantastic. Um, let's talk about GPCRs a little bit. What is your favorite GPCR?
Mm. So since I work GPCR, I started with often GPCRs,
Mhm.
and I'm now still working on often GPCRs. And
Okay.
if I have to pick one, I would pick the one that I'm working on now, which is GPR-52.
Mhm. It can be a family as well. It's not necessarily a receptor. And this came up multiple times because sometimes people would say, well, I don't have a favorite GPCR, but I have a favorite phosphorylation site, or I have a favorite G protein or something like that. So it makes a lot of sense. And it doesn't have to be GPCR. So maybe it's GPR 52,
Yeah,
but also orphan
can be
GPCRs
other.
in general.
Yes. They are quite challenged. So when I say my favorite, I always picturing that, oh, they make me like a work on them easily,
Yeah.
but not. They are not. But I
No.
can't say, yeah, it's not my favorite.
Yeah. Well, GPCRs, I think they all have their personality. Um,
Yeah.
and sometimes they let you into their inner circle, and sometimes they're like, no.
Yeah.
And
Yeah.
and sometimes you get lucky and the
Yeah.
GPCR just does what you need it to do in the right assays, and sometimes you struggle. And I think orphans are in that interesting category that you never know what you're gonna get.
No. So yeah, I think it's the time that you spend on studying them that actually helped to build a special bond
Yeah,
between me and the receptor. And I
yeah,
think that's the why I feel like this is my very favorite because
yeah,
my time and as well the bond
yeah.
between.
No, I totally can relate to it. I mean, if I'm thinking about a receptor that I really liked working with, that worked really well, that was, I want to say, almost a walk in the park, and those are very rare, then chemokine receptor CCR2 was or is my favorite in that regard because I worked on it at the end of my PhD. I could have graduated, but I stayed back a year to finish the project.
Mm.
And every assay you would do, I would do with CCR2. I would do it 3 times, optimize, do 3 times, and the figure was publication quality. And I'd be like, how come? You do it in triplicate and there's no error bar because the triplicate, everything looks beautiful. And when we submitted the paper, it came back with, I think there was one question around an abbreviation we used in a table, and they were asking if TBD is to be determined or to be detected, something, and that was it. That was the
Uh,
only comment, and I think that's such a rare thing. I have the reviewer comments saved because those were the best reviewer comments ever. So
wow.
I can relate to the relationship building with the GPCR, with your GPCR.
Yeah, yeah. It's a yeah. Well, in your case, it's really like a dream GPCR to you.
Yes, it was. It was then. Then I worked on CXCR3 and everything got messed up. And that receptor just with the splice variants, and the splice variants was just a nightmare. But then I conquered them, I'd like to think at least, but it was a 3 or 4 year work
Mm,
on the splice variants. So CCR2 was just literally a walk in the park for that study. Everything just worked, which is
yeah,
very
it's
rare.
it's very yeah, agree.
So tell me a little bit more about your favorite receptor. What does it do?
So yeah, so without we still don't know about the endogenous ligand and its physiological roles still like
Mhm,
not clear yet,
mhm,
but yeah, it being shown to be a potential target for treating mental health disorders such as schizophrenia. So the small molecule agonists that have shown antipsychotic activities, and well, as well as like pro-cognitive properties. Yeah, yeah. So it's a potential for doing. Yeah,
It's interesting, and it's at the same time frustrating because you don't know what the endogenous ligand is. What does it
yeah,
do? And do we know
yeah.
when where GPR52 is expressed?
Yes. So it expressed like a
Oh,
very extensive, like almost exclusively in the brain, and specifically you can find them like largely in the striatum. Yeah,
and well, obviously schizophrenia, so it's obviously in the
yeah,
brain.
it's yeah.
It's
The locations, the expression locations also make it very interesting to study this. Yeah.
mhm, mhm. How was the small molecule identified? You mentioned the small
So
agonist.
yeah, I think yeah, like a few years ago, it was published, and I think they were like largely identified by high throughput screening, and
Mhm,
then some like optimizations
yeah.
like already existing hits. Yeah.
Wow. Still, I think I just think about, a receptor that's an orphan that's expressed in a very specific part of the brain.
Yeah.
Then you have a small molecule that has great promise, but you still don't know what the endogenous ligand is. It's such a frustrating just
Yeah.
thought of not
Yeah.
knowing what does it do. And it makes me wonder what other orphan GPCRs are expressed in the brain that we don't know about.
Yeah. Yeah. Like identify more
Yeah,
more
yeah,
GPCRs.
exactly. Complicated. Um, and then with this receptor, do we know if it interacts with any other GPCRs in the brain? Do we know it forms dimers, and I'm completely,
Yeah.
if you don't, if we don't know, we don't know.
I personally don't know. But I like it co-expressed with the dopamine D2 new receptors in the striatum, but does it has like a direct interaction with it? Like I don't know. Yeah.
Yeah. I'm wondering if all of these, you know, receptors that control brain function and that are implicated in all sorts of neurological disorders interact, and kind of, I'm trying to think about this like neural network from a GPCR perspective in a disease setting, and see how these guys actually influence each other's function, and do they interact either physically or functionally, which
Yeah.
we're not there yet, but still it could be a really
No.
interesting
Yeah.
topic.
Yep.
Many
Yep.
PhD work, many the work of many PhDs to potentially get us there.
Yeah.
So I wanted to ask, where are you? You mentioned that you haven't defended your thesis yet. You're towards the end of your PhD. Can you tell us a little bit more about where you are next, where you are now, and what next a little after that?
Yeah. So I am writing my thesis, that, and as well as I am still finishing up on some experiments I would like to finish.
Mhm.
And I feel like this is like, now I realize it how precious PhD time actually can be, because the 4 years allows you to explore questions free, like a sort of freely. And yeah, so that's where I'm now. So just trying to do as much as lab work before I finish everything, but also still writing up, because I don't want to drag like delaying the
Yeah.
writing progress. But it's hard to do both at the same time, because the brain just doesn't switch as quick as I would like it
You're
to.
not alone.
So where next, I would definitely want to get a job after I submit, and or even if I could get chance to uh, find jobs before, like during this time.
Mhm.
And but yeah, I don't have a like a really goal, like, or like, such as working in the academia or working
Yeah.
towards a company set or something like that.
Mhm.
But I'm open to all these
Mhm.
opportunities. Yeah. Yeah.
I think, oh, that's great. And let's take a step back to the writing and working in the lab. I for me, and I think a lot of us, I can't do both. I could not do both. It's either one or the other. And spending 4 or 5 years in the PhD program doing lab work makes you tend to escape writing by doing lab work.
I do that. I do that.
And it's just, I mean, writing my thesis was like pulling teeth. It wasn't hard. It's just my brain just was not cooperating. And it took me
Yes.
forever.
I think in my case, I feel like all my muscle memories are in the experiments part, like doing lab
Yeah.
work. It's just so fluid and so continuous. But when I
Yeah.
come to writing, everything just starts, and like I have
Yeah.
to pause a lot of times. And after a day, I look back what I wrote, maybe just like a one sentence or two sentence, and that just like makes me feel
Yeah.
so anxious.
Yeah. It's hard. It's hard because I think we're trained as PhDs to think about, you know, doing lab work. That's if we were about top three, it's doing lab work because obviously that generates data.
Yeah.
And then reading papers, which to me was very difficult because I had to do lab work. And then number three, the writing part. And it's like this pyramid, this inverse pyramid with at the bottom you have the writing, in the middle some little line for paper reading, and the rest is just lab work. And
Yeah.
I'm wondering what kind of advice we could be giving today to people, including you, facing this. And it's hard. I know it's
Yeah.
super hard. And I'm glad I'm not the only one who was having trouble doing these things, but I think you need to have dedicated time where you tell
Yeah,
yourself, I'm closing
that works.
everything. Don't talk to me. Don't look at me. Now I'm spending 1 hour on this. And then
Yeah.
what works for me is breaking it down to small tasks.
Yep.
Like small, today I'm writing, I don't know, 1 paragraph or 2 pages about this topic only.
Yep.
But then again, you have to monitor yourself because I don't know about you, but the way my brain works, I do like 10 things at the same time. Like I do this and like, oh, I have forgot to do this. Now I need to do this. And then, oh, I forgot to do that. And it looks like I'm not doing anything, but I am. What I realized is it's for me, things still advance. But in order
Yep.
for me to feel satisfied at the end of the day and say, wow, I did all of this work, is to really to focus on one task at a time.
Yeah. Yeah. That's a good one. Yeah. I think I can't do 10 things at a time. I can maximally maybe do two or three things. But what things always get priority is the things that I'm good at doing. For example,
Yes.
experiment.
Yes.
And then because at the end of the day, if I have three things to do, I can quickly finish the first two that I'm good at doing. And even I don't finish the last one, I would still say to me that, oh, you have done two things already, but that's
Yeah.
two things you know too well to do how to do
Yeah.
them.
Yeah.
So doesn't like if I only did the last thing that I'm struggled to do and I didn't even finish 50% of it, it makes me feel so guilty sometimes.
Yeah.
Like I could spend the time better than
Yeah. Yeah.
to do something else. But I think yeah, the writing part is just like you really needed to like dedicate a solid
Yeah.
time for it.
Yeah. Yeah.
And for me, I think I have to dedicate maybe 3 weeks to write like a really, really uh like a solid piece that
Yeah.
yeah,
Yeah.
yeah, yeah.
I think, and that, I don't know about you, but in my case, what helps a lot again is to kind of, in addition to carving out the time and saying, okay, this is all I'm focusing on, is having. I use Trello a lot, and by the way, we're not sponsored by Trello. I just love using it as a tool, and I use the free version of it, where I can map out kind of high level all the projects I'm implicated in, and then have one card per project, and within that you can have a checklist, and then just it. So I always have this feeling of, oh my God, I have so many things to do. I don't know what to start with. And
Yep.
when I put everything in Trello and I map it out and I make a to-do list, a checklist for all of these, then my brain is like, why are you so panicked? This is completely manageable. And
Yeah.
once I have my checklist, you can make a card out of your checklist and then add a due date to it. And you just don't have to think about the grand scheme because all the time, because you thought about it once. In your case, you would translate it in the grand structure of your PhD thesis. And then you would break it down and you tell yourself, okay, every week I'm going to write about topic 1, 2, 3 within the section.
That's a good one. Very good one. I'm gonna try on
That's
that.
that's a
Starting.
that's a thought, and that makes me, that doesn't mean that I don't have these panic moments, and the Trello board needs to be updated, but at least for a short period of time, for a short sprint, I know that I don't have to think about anything else. This is the most important things that will get me to the next step.
Yeah. Yeah.
But it's writing is hard.
Yep. Yep. I
Yeah.
totally agree.
It's
Not
not
for
easy.
everyone.
No, and I think writing a thesis is no. I don't want to say it's a rite of passage. You have to do it,
Yep.
but it's boring at the end of the day. Writing a paper is way more exciting, but then it's more exciting by the time you have collected the data, analyzed the data, and have the figures,
Yeah.
and then you can get to write the discussion. Because writing the materials and methods is just a headache. It's easy, and that's why
Yeah.
I had the tendency to start with that.
Yeah.
Um, but I think, all of these are like ups and downs in that sense.
True, true.
So when is your thesis due?
I think I have a day. It's 16th of September. I have that in mind. Yeah.
Okay. So you still have a little bit of time there.
Yeah, just a little bit because now we are almost June.
I know.
Crazy.
I know. It's
Think
just,
about
let's just
it.
get into the conversation about how fast this year has gone. It's just incredible.
Yeah, yeah.
Incredible. And then you mentioned, so, handing in your thesis in September, defending sometime before the end of this year, and then you're ready to be starting a new position, a new adventure next year.
Yeah, hopefully if everything like works really well, then yeah. But I still like a delay in my the initiation to like seek for job opportunities or
Yeah.
look what out there already. I just
Yeah.
yeah.
No, I think you should start looking right now so
Yeah.
that by the time all of this is done, submitting the thesis and then defending the thesis, you have a job lined up.
Yeah.
I think that's important. So anyone looking to hire in 2024, who to who to talk to. What kind of are you? So you mentioned that you don't have any preference for industry versus academic jobs. Would you still like to continue working on GPCRs?
Yeah, it would be a very I definitely consider, yeah. Because I won't say if I can find a job within the GPCR, I think I would love to take. But if that is something that outside of GPCRs, I wouldn't say no. Like
Yeah,
yeah,
of course. Of course,
yeah.
yeah. You're not gonna be like, don't talk to me if you're not working
No,
on GPCRs.
I love GPCRs, but it's
But
not
yeah,
like
that would be a bonus, definitely. Do you know what kind of work you'd like to do? Would you still continue to be a bench scientist, or would you want to do something different within?
Uh, I would be happy to start with a bench scientist just
Mhm.
straight after I graduate. Yeah, it's still like yeah. I think PhD is a time like a training me to be thinking uh along when I work on the bench
Yeah,
and like to make a plan for the work and to think in a bigger picture wise. But I'm
yeah.
still like trying to master this skills. So to yeah, to how to better transit from the either from bench to more like kind of planning work or something.
Mhm.
Yeah.
Yeah, there's so many opportunities out there in general, especially I want to say in industry. In
Yeah.
academia, there's a lot of type of jobs that keep you close to the science, but at the same time get you out of the lab. So it's, I think, worth considering
Yeah.
what kind of positions you'd be interested in. And it also
Yeah.
depends on whether do you still like working in the lab or not,
I
you know?
like.
There you go. I think the answer is that I loved working in the lab up until about 3 years ago now, where I was like, oh my God, this is
This
great, but
is
it's just not as exciting. It's just taking too long, and I can't wait to see the data. But then the data, I am dependent of how my cells grow. And
yeah.
if the cells
It's
grow and I have to be there at 6 a.m., I will be there because I'm gonna miss my shot as at running the assay. Or,
yeah.
I could tell just by the way the cells looked in the plate if it's gonna work or not.
Oh,
And I think that's the good time to quit working in the
yeah.
lab when you just look at them and
You know
what's
it's
gonna
gonna
happen.
work or not.
Yeah, yeah, just by the density of cells, just by the way, I'm speaking here about Hec cells, just by the way the light is reflected when you look at them through the microscope, and you can tell if they're healthy or not, or
Yeah.
if there's enough cells in the well that you just plated for the next morning, then I think that's a
Yeah.
whole level of expertise, and it's time to pass on the baton to somebody who needs to learn these things.
Yeah, definitely. Yeah, I think for me, I just haven't really like I thought about things outside the lab yet.
Yeah.
I'm just
Yeah.
now I'm fully in this.
Yeah.
So
Yeah.
can't, yeah.
But I think you do have time, when you're writing and while you're writing and submitting and thinking about what's next. I think now is the time to think about, okay, what else is out there,
Mm,
including bench scientist jobs, and think
yeah.
about just at least get the information and feel like,
Yeah.
okay, maybe I could do this or no. I think just as you mentioned at the beginning that you knew what you didn't want,
Yeah.
I think putting
That,
the next steps in your career into these categories of what I don't want versus what is okay, what I'm excited about, I think it's really an interesting one. Since you mentioned working on orphan GPCRs, and everybody knows in the field that these are very challenging. If you had a magic wand and you could come up with a new tool to help you with your project or to help people working on orphan GPCRs, what would that look like? And I understand the question is kind of use your imagination. You can say pretty much anything that you want.
a magic one.
Yes.
Like to make it work like
Yes.
instantly.
Yes, a tool or something. The reason I'm using this is because when I was talking to Anthony Boucard, who is working on adhesion GPCRs, he said he would love to be able to, go down onto the plasma membrane and watch adhesion GPCRs do what they need to do. But others had specific ideas about some kind of tools or some kind of technology to help advance the work on their favorite GPCR.
Yeah. I think, yeah, because now we know this often GPCRs, like little by little, like we just use our tools, like currently we have to know, but how can we connect everything in like to make everything make sense and how to see that single often GPCR where it sits and what roles it does. Like I hope there is something that can help us to connecting the dots or even to point out where the dots are so then we can go and to make things
Yeah.
connected. Yeah. But
No, I think
yeah,
so.
yeah.
I thought you were gonna say you want to take a tour in the brain and go get DPR 52
Yeah, like
say
a
hi to it. Yeah.
yeah, yeah.
No, I think machine learning and these big data tools where you at some point it's very hard to make sense of
Hmm.
the large amount of data that we're generating. So I think
Yeah.
we need to have tools to kind of integrate all of this
Yeah.
and then look at it from not 30,000 feet view, but 100,000 feet view where you can have an idea as to what's going on back and
That,
forth. And that's super difficult. That is
that's
very
very
difficult.
yeah.
Mm.
Yeah.
Cool. All right. Top three aha moments that you had as a scientist that shaped
Mm,
your trajectory. I think I have a watch beeping. Don't never mind that. I don't know. I hope you cannot hear it.
no, I
But
have,
that's good.
yeah.
That's good.
Top aha moment. I think yeah, my path has not been that long to have like a real like aha.
Well,
Um
I think everybody has, and the size of the aha moment does not
yeah.
matter. It's just something that you thought, oh, okay, now I know this, and now I'm thinking differently about something.
Mm. I think I can't think of like well the most aha moment
Mhm.
to me is after my undergraduate because I did my undergraduate in University of Adelaide in Australia, so which is a different city. And after I'd done that, I could have chosen to do continue to do honors degree in the same city because that would be easier or something. But at that moment, I know I wanted to go something challenge. So that moment I know, I want to do more and see more in the different institutes or something. And the second aha moment is after I taking my challenging did my honors in a different city. I know that no, I don't want to, I'm not mentally prepared yet to continue to do PhD. So those are two moments that shaped my path to now. Yeah.
Now, I think it's important, and I think you had that instinct of saying, I need change and I need to do something. I need to prove to myself that I can succeed in a different
Yeah.
city, in a different
Yeah.
setting, in a different university. And I think that's very important.
Yeah.
That helps a lot with growth. I don't know who I was talking to, and oh, I think I can't remember, but the person also moved from a small town to a large university town. And they said, well, this was the first time I was 20 and I was living alone or having roommates. And first time I had to, do my dishes or do stuff like
Yeah.
that. And that's an important milestone. And that's very important because you learn so much about
Yes.
yourself and you
Yeah.
grow.
And yes. Yes. I think, yeah.
And I think that's fantastic. What
Yeah.
else? Was there anything else? Did I interrupt you? Sorry.
No, I mean, yeah, I mean, just like when it's at this early stage, I tend to think, oh, I would love challenge and how hard it can be, but then so you can take on the challenges, but
Yeah.
then you're shaped by your everything, like every experiences. Yeah.
Yeah. Yeah. I was looking at someone on LinkedIn posted about a book about PhDs. I'll send you the link. I think it's worth taking a look at. And there was this graphic around it, like comfort zone and then fear, and then there's something else, and then where you actually develop. And I think it's very hard to get out of the comfort zone, but if you
Very.
don't, you will never grow, you will never experience things.
Yeah. And it
And
becomes harder and harder to do so, even like you when you move on.
yeah,
So you when you feel like you need to break that, you have to do that right now.
yes, yeah. So listen to your instinct basically and do what feels right at that moment. And I think it's important to get out of the comfort zone. I mean, just look at the podcast. Some people would tell, I've invited people, students, trainees, PhDs, postdocs, and even PIs who said, yeah, I'm not comfortable. It's fine. I totally respect that. But I think a lot of people who came on the podcast and came back and said, you know what, this was so much fun. I never
Yeah.
thought I would have so much fun. And, you know, it was uncomfortable for me the first couple of times. I was so stressed out first couple of episodes. And now it's a walk in the park. And
Yeah.
I really enjoy it. I get energized by recording podcast episodes all the time. So I think it was uncomfortable. I knew I had to do it. I felt like I had to do it. And now it's gotten so much easier.
Yes.
That doesn't mean
Yes.
that I don't have that moment of, okay, I know we're recording, I have to be careful and things like that. But at the same time, your just as your muscle memory kicks in to go do work in the lab, my muscle memory kicks in to do this to the best of my ability. Not to say that sometimes it doesn't work out. I've had episodes where my kids came in. I've had episodes where during recording, I first started recording in a closet. So we had a table put against like into the wall, and the table fell into my lap with a laptop on it. But then we finished, and I think it's fun then to tell the stories.
it's part of the experience.
Exactly, and we didn't cut it out. Just like, well, it happened. We're sitting in a
Yeah.
closet. And then we upgraded to an actual room, which I think it was a
Hey.
big improvement. All right, last question. Last but not least, we kind of talked a little bit about getting out of the comfort zone and, doing something that you needed to do by moving. What would be your advice to scientists, PhD students, or even postdocs, or anyone you think could benefit from it,
Mm,
who want to
mm.
contribute to the field and evolve?
Yeah, so I think just to summarize my own experience and feelings from my the all the options that I have made, or like the decisions I have made, it's just I feel like it worked for me that take my time to do things,
Yeah.
and it doesn't. I think there's no rush for me because some people question or asking, oh, 7 years of for doing research assistant before you continue PhD, because it also you're not doing your PhD at the same age as your peers now.
Yeah.
So some people picturing things more like that, but
Mhm.
I think it can't. I can't push myself to do things um,
Then.
earlier.
Yeah.
Then I will need to take my time to sharpen my skills,
Yeah.
either like a mentally sharpen my skills and or the bench skill sets. And yeah, I think everyone, like, we can't be afraid to take our own times, because yeah.
I think you make a great point. I think we're all different, we're all unique, and we're all special in the best possible way. And everybody has their own rhythm, their own time, and that must be respected. You don't know what's
Yeah.
going on with the other person. And I was listening to I don't know if you know this guy, his name is Simon Sinek. He's not a scientist, he talks a lot about company culture and
Yeah.
a lot about humanely thinking about people. And he had this example, and he was mentioning, you're driving in your car, and then somebody's honking at you, or doing weird stuff, and then what's your reaction? You typically
Mhm.
honk back, maybe you roll down your window and scream out something. But then I think it's also important in that example to stop and ask yourself what's going on with that person. We don't know.
Yeah, no.
Maybe they have a family emergency. Maybe
Yeah.
they need to be there somewhere. Maybe they have a job interview and they have been out of work for 6 months. Or maybe
Yeah.
they're just rude. You don't know.
No.
But just taking the step back and saying, well, I respect the other person and I think about, we don't know their circumstances, and everybody has their own time. And kudos to you for wanting to do a PhD and for
Yes.
doing it, and it's all out of
Yeah.
hard work.
Yes. Yes. Yeah. I think it's really important to know your own pace, and you get to know yourself well. Yeah.
Yes, yes. And I think again, going back to the point where you had mentioned that you knew what you did not want to do, that's
Mm.
part of knowing yourself and knowing your limits and knowing what you're
Yeah.
interested in.
Yeah. Yeah. That's
Any other advice?
um,
I'd say take the time to write your thesis, set time aside. Don't go work in the lab all the time. You will never get your PhD
yeah.
thesis written.
I need that. Yeah. I need to do that.
No, I agree. I agree with, and it's hard. It's such a hard thing to stop. At least it was for me. I think it took me months, maybe 3 to 4, even 6 months of, not only writing, but also putting together a manuscript that would go into the thesis. And it was such a painful process. And then you have to defend the thesis, and then you have to make the slides. And
Yes.
without giving your PI a heart attack that your slides are not ready on time, which I did give my PI a heart attack, almost figuratively, obviously, speaking, because my slides were not ready the day before. Me
Oh,
defending, but they were ready by the time I defended. So that was completely me, last minute, swoop in, done.
it also works, like the last minute works for me so
Yeah,
far.
yeah,
It's just
yeah.
the last little push.
Exactly, the last adrenaline push, but I have to say I'm not like that anymore. I like it when I have enough time, when it's planned out, when it's on my Trello board, when it's in my calendar. I have this new rule: if it's not in the calendar, it's not happening.
Hmm, good.
Because I can't keep everything in my mind. Maybe it's an age-related thing too, but
Yeah, yeah.
if
I
it's
think
if it's not written down, if it's not tracked,
no,
I
it's
don't
not gonna
guarantee.
happen.
It's not, no,
No.
absolutely not. All right, Jackie, thank you so much for your time. I really enjoyed our conversation.
Thank you very much for having me, and I also very enjoyed conversation with you.
Thank you. I'll talk to you soon. Thank you for joining us and listening to this Dr. GPCR podcast episode. We would like to thank our guest. We also want to say thank you to our Dr. GPCR team members, Attila, Ines, Montserrat, Ivana, Andreina, Balint, and Julia. A huge thank you to our ecosystem partners as well: Domain Therapeutics, GPCR Therapeutics, Design Pharmaceuticals, Montana Molecular, and Orion Biotechnology. You can connect with our partners directly in the ecosystem, so don't forget to join us today. Please subscribe to the Dr. GPCR newsletter, find us on YouTube, and if you like our podcast, leave us a 5-star review on Apple Podcast. You can also leave us a testimonial at drgpcr.com/testimonials. Another great way to support us is to share your favorite Dr. GPCR program with your network and colleagues. With any questions or suggestions, feel free to email us at any time at hello@drgpcr.com. Until next time, stay safe.